I'm Mark Mueller. Welcome to Truth and Justice League podcast. And we have a very special guest today, Eleanor Womack. She's a doctor.
Yes.
And her specialty these days is hyperbaric oxygen treatment, among other things.
Yes.
Welcome to the show.
Thank you. Thank you for having me here.
I'm so excited about this. Because one of the things I would like to do with this program is talk to people about what we can do to help ourselves in this era where a lot of people are suffering from chronic health diseases, acute health problems, all kinds of things. So tell me about hyperbaric oxygen and how you got into it and what you're seeing in your practice.
I've had a functional medicine practice here in Austin since 2011. And about 2014, 2015, I was realizing that a lot of what I was doing was helping, but it wasn't moving the needle as much as I wanted it to. And I had a patient come in with major dental and cardiac issues. And after I'd assessed him, I arranged for him to see a dentist immediately that day. And he went into surgery, for he had horrible abscesses that needed to be done right away. And under his breath, the dentist said, if you had a hyperbaric chamber, this would be healed really quickly. And the gentleman had means, and he went to work, and 3 days later, there was a steel-sided chamber in his garage.
Wow.
And he began treating himself. And so he came back to see me in 2 months, and the transformation of him was just amazing. And I thought, this is what I'm missing. And so I was changing offices, I was expanding my practice, and I kept my old space, and I put one chamber in there. And over that year, I was able to be profitable and buy a second chamber, pay off the first one. And each year for 4 years, we paid off a chamber. So we had 4 chambers, and we were seeing about 21 people a day in our hyperbaric office. So we expanded to Round Rock. And in Round Rock, we've now been up and running, seeing about 16 patients a day for the last 5 years. And we have just expanded and opened last week in Lakeway. We have 2 chambers there, and we're only seeing 1 patient a day right now. But we're getting ready for a grand opening.
Okay.
Yeah.
Well, how does it work?
How does it work?
Yeah.
Well, right now, if I put an oxygen saturation monitor on you and on me, we would be 98, 99% saturated. And what that means is that there's an oxygen molecule on every hemoglobin molecule inside the red blood cell, and it's being carried in the plasma to the place where it's needed to provide oxygen. I can't get more than that. So if I put you on oxygen and continue to match your saturation, we might go from 99 to 100, but we wouldn't be able to get more oxygen into your tissue. Under pressure, gases turn into liquid. And we know that because when we put CO2 into water, we get seltzer, and that's under pressure. When I let the pressure go in 7 or 8 hours, there's no more oxygen in that seltzer. It's all come out. Well, in hyperbaric, what I'm doing is I'm putting you under pressure, and I'm having you breathe oxygen. That oxygen is now dissolving, it's not traveling on the hemoglobin, it's traveling in the plasma. So now I really have an unlimited reservoir where I can put as much oxygen as I possibly can into your tissues. This is the really cool part. You are loaded with oxygen during the treatment, and then we open the door and you come out. And that oxygen is now bubbling up into your body and going into your tissues. And over the next 4 to 8 hours, you're experiencing this impact of an increased oxygen supply for all your tissues to do the healing that they want to do. And I tell people it's like a city that has a low budget and can't build new schools and can't get roads, and the police station is decrepit. And with all the workers available and everything else, they still can't do it because they don't have the budget. When I give you excess oxygen, I give you an unlimited budget, and now you can build new blood vessels, new roadways to get new places. Now you can build a new school. You can build better brain. You can build a better pump. You can build a better pancreas. You can get rid of inflammation. You can do things you couldn't do because you just didn't have enough budget.
Wow, that's a lot. What kinds of health issues are some of the major ones that you are working with, and tell us some of the results you've seen, and at some point get into what are the downsides of this stuff.
Okay. Well, there are 14 conditions that the FDA approves for the treatment for use of hyperbaric for treatment, and those are generally what we see the big hospital chambers being used for. And those are almost all wound related. And those are about tissue that is necrotic and is that's putting the person at risk of the loss of their life. And the reason those have been approved is because the historical way that hyperbaric developed in our current culture, although it's been around for 400 years, but in our current society, it's been through the people that are diving for the Navy. And when you use hyperbaric in diving, you actually need to go to much higher pressures than I think are actually where I'm treating people and what I think are useful. And in fact, those scientists and those physicians looked at the kind of pressure that I'm doing as being their placebo levels. They didn't think that what we're doing was effective. They didn't know that it was effective because they were focusing on how to get people out of the bends who had been 100 or 110 feet underneath the ocean. So if I'm going to make a hyperbaric chamber that works at those very high pressures to reverse the bends, I have to pressurize the chamber with oxygen. Then the ethics of putting someone in because they want to anti-age or putting someone in because they have ulcerative colitis becomes impossible because the machine itself, with oxygen in it, pressurizing it, is a bomb. And so the big division in the way that we look at hyperbaric is based on this danger of the hospital chambers where are pressurizing at higher than 3 atmospheres and pressurizing with oxygen. They're very good at treating wounds, but they're not good at treating the brain, treating the heart, treating anti-aging, treating the skin, treating the things we want to. And you would certainly never put someone at risk because they had a skin blemish to put them in at those kinds of pressures. It wouldn't make sense ethically. The chambers that I have, I now have 10 of them.
Wow.
The chambers that I have in my clinics are chambers that are pressurized with ambient air, and the person is provided oxygen by a mask while they're in the chamber, and so the oxygen is going in really closely to their face. The oxygen is then in the space of the chamber, but the air in the chamber is also constantly moving through and being replaced. And so we're keeping a very low oxygen tension inside the chamber, and there's very little risk, if any risk, of a spark igniting something. So therefore, I can now use it for these quote-unquote frivolous diagnoses that are not direct wounds. I would argue that anyone with any kind of brain problem actually has a wound inside the brain. And if hyperbaric oxygen fixes a wound by decreasing the inflammation, decreasing the infection rate, and improves the ability of cells to move in and heal, the same thing's going to be true inside the brain. So if someone has chronic traumatic encephalopathy, CTE, or if someone has chronic brain injuries of some other kind, or they have had a stroke, or they're struggling with Alzheimer's, we can treat them with an increase in oxygen. The body will heal itself. I'm getting oxygen. So the other little thing about oxygen being carried in plasma instead of on a red blood cell is that when oxygen leaves the red blood cell, it can only travel for 50 microns outside of that capillary where it left. But if I'm carrying the oxygen in plasma, I can now go to 150 microns. I can go 3 times farther, even sometimes 5 times farther out than I could when I left the capillary. So gray tissue, white tissue like sinews and bone, and the white matter of the brain can be healed by getting oxygen to places where it couldn't get there from a capillary in the past. I'm getting oxygen deeper into the tissues than I was. So what do we see in my clinic? I would say about 25% of it is neurologic. 25% of it is people who've had multiple concussions, people who have had some sort of Alzheimer's diagnosis or dementia diagnosis, or someone who's post-stroke or very immediately post-stroke. And then I would say 25% are people who are doing it for health and wellness. They're doing it because they're biohackers. They're people who want to get the most out of their mitochondria. They want to get the most out of their health. About 8 to 10% are people who've heard about the benefits in the treatment of cancer. So we are working with professionals who are using chemotherapy or using radiation, and that's actually one of the 14 approved diagnoses for hyperbaric is someone who's having radiation and it prevents the destruction of the jaw or the bone in head and neck cancers. More of those patients go to the hospital, but we have even seen a few here. And then also when someone's undergoing a chemotherapy regimen, if they can come in on their off week for 2 or 3 sessions, we can often help them from the very lowest white blood cells counts they would have had, and we can also help their guts heal faster. We can also help them recover from help the healthy tissue recover. Cancer tissue itself doesn't really like oxygen. It's fermenting, it's not respirating. And so hyperbaric oxygen doesn't seem to help the cancer, but it does help the normal tissue in patients. Again, this has to be under tremendous advisement, and there's some circumstances under which you would not use hyperbaric with cancer, but there are many where you would. And then there's a very strong cadre of people who are doing surgical procedures, either electively or emergently, people who are having facelifts, or people who are undergoing any kind of platelet-rich plasma or stem cell collection for injection. We can actually increase the harvest of those stem cells if they'll do a couple of hours at 2.0 with us. They'll have a better harvest and a better outcome for their regenerative procedure. And then we've got a few other things. The 14th of those diagnoses on the FDA list is actually sudden hearing loss. And so I probably am seeing somebody 2 or 3 times a month with sudden neural hearing loss who can't get into one of the hospital chambers. We don't take insurance in my clinics, but our prices are competitive, and so a lot of people will choose to come to see us for something emergent like that because it takes too long to get in to insurance-based hyperbaric.
Well, it seems like this is another one of those we need to, as a society, focus a lot more on prevention and actual treatment of underlying conditions.
Well, there is, I would love to digress into something kind of cool.
Yeah.
And just tell it really quickly and then explain some things about why we might really want to use hyperbaric more often. In 1952-53, there was several physicians who wanted to get hyperbaric used in operating rooms. They wanted to get people who had heart conditions or infants who had heart conditions. They wanted to build a hyperbaric operating room where you could have conditions of hyperbaric while the patient was being treated in there. So to prove that, they did a stunt where they took 5 pigs and they completely exsanguinated them and replaced their blood with saline in a hyperbaric chamber and then allowed them to live for 3 weeks. And they lived inside the chamber for 3 weeks as normal little pigs. And they didn't have all the great juice that our blood carries, but they had all the oxygen they needed, and they lived beautifully. Their blood was then returned to them, and the pigs lived a normal life. So to understand that you can, so let's say a baby had a severe heart condition and could be born in a hyperbaric chamber. That baby wouldn't need some of the life-sustaining stuff that needs to be done. They might not even need to be intubated right away. And the doctor would have more time to do something, and there could even be the possibility of a direct procedure right away. So there are many ways in which hyperbaric could be incredible. There are situations where someone has had a severe burn. And I would postulate that we could treat somebody with a severe burn with hyperbaric with 2 long sessions twice a day during the first week of their burn, and really change how many surgeries they would need, how much they would need to treat the scar tissue. And there are stories of people who got burned underwater in explosions that took place underwater, who then the first thing that needed to be done was to deal with their bends. And so they underwent 8 hours of hyperbaric and resuscitation while they were, and they still had the burns. But when they came out, the burns were so much further ahead in their healing. So there are many places within medicine where hyperbaric could be a tremendous game changer, and it's not even thought about it. As a medical student, I went to Harvard Medical School, and there was no education on hyperbaric. I learned about it in the hospital because there were a couple of patients that went for situations where there was gangrene. But that was, so to me, it was that bomb down in the basement at the hospital. For other people, it's that thing you use if you're going diving. But people don't understand that there are gradations that are amazing. There is another really wonderful thing going on. There is a phenomenal young man named Jason Saunders who just got his PhD in biomedical And he did his big paper comparing very, very low pressure hyperbaric at 1.3 atmospheres, which is the same atmosphere you would go if you went to the Dead Sea in a lot, you would be at 1.3 atmospheres. And there are people that go there for the health benefits of the 1.3 atmospheres. So there's 1.3 atmosphere chambers, and those are the chambers that generally are at Restore Hyperbaric, where there's a zipper on it and you get in and out, and sometimes there's oxygen, sometimes there isn't. And he compared that to 2 atmospheres of pressure, which would be the highest that the clinics that I run and the kinds of clinics like mine would go to. And in comparing those, he didn't know what to expect. He thought maybe the 1.3 would truly be found to be a sham, that it isn't real, that it wasn't really helpful, that it could be something that could be used as a placebo. But he didn't think so. He thought there was going to be some results. But he thought maybe they would just be less than the 2.0, that the 2.0 would be doing something really amazing. Well, what he's found is incredible. He looked at the methylation of DNA, which is the turning on and the turning off of the genes that we want. He looked at cytokines. He looked at general biochemistry, and then he looked at several questionnaires and tests that you could do for cognitive ability. What was so amazing was that the DNA was methylated in a different way at this 1.3 atmospheres than it was at 2 atmospheres. And that even suggests that for neurological issues, there may be more benefit at 1.3 over a long period of time than there is at the 2.0. In general, what I'm doing in my practice now is I'm having people try to get a chamber for their home if they have a severe neurological issue that we think we're going to be dealing with for years and years. So if they've had a stroke or if they're dealing with dementia, and get in that chamber as regularly as they can in the home for 60 to 90 minutes every day with a break once a week. And then come to my clinic and do 10 sessions every few months at the 2.0 so that we get benefits of both. But so what we're really seeing is that every time we apply oxygen and pressure, even at the lower atmospheres to people, we're doing a tremendous boon to their health.
Wow. How long, what's your recommended, length of treatment, for...
So that's a cool question, and it has differences for different people. So if you have just undergone a facelift where they took this and put it over here, you might want to come in for 2 sessions before, because then you'll have mobilized stem cells and your body will start healing even faster. But if you can't do that, at least do 3 sessions following your plastic surgery. And the reason is that in the chamber, we get a decrease in vascularity. The swelling of any situation goes down dramatically. And I've seen women with their face this big come out after just 90 minutes and already you can see their facial structure again. And after 3 sessions, they're already healing at a rate that probably would have taken 2 weeks earlier. So in plastic surgery situations or in an injury situations, we might do as few as 6 to 10 sessions to get you back onto your healing platform so that you feel comfortable. I would say also people that have had massive dental surgery, the same sorts of things. Then if we're dealing with, let's say I want to do that biohacking anti-aging thing, and I actually want to see my telomeres get longer. Well, there are several papers in the literature showing that if you do 60 sessions at 2.0 atmospheres and you do them stacked together, so it's important with hyperbaric that we stack the chambers, that stack the interventions together, then over a 3-month period, you could do 60 sessions and your telomeres would be somewhere between 15 and 25% longer, meaning that you had longer life.
Wow.
And you would also notice an improvement in your cognitive ability. You would also notice an improvement in your skin turgor. You would also notice an improvement in your healing. You would also notice, if you were looking at your blood, that your hemoglobin A1C, the measure of blood sugar and longevity in people, had actually dramatically improved. You would see a decrease in cytokines. You would see a decrease in the things that are destructive that would be causing the chronic inflammation in the brain.
Let's talk about some specific conditions that are becoming apparently more prevalent. I work on chemical exposure cases. It's one of the things I'm doing now. For years, I worked on what you would call loosely birth injury litigation, HIE cases. Kids didn't get enough oxygen, blood flow, brain gets damaged. In the chemical exposure cases, what we're seeing is a very big uptake. I'm talking about exposure to trichloroethylene, exposure to pesticides, those kinds of things.
So these are direct mitochondrial toxins that are affecting the person's body by shutting off the ability of the body's cells to make the energy to even take care of the cellular garbage takeout, let alone do the work the cell would normally do. That would be my guess.
Yeah.
Yeah. Okay. So what we're doing in hyperbaric is directly affecting mitochondrial function. So in people who've had mold exposure, which would be a very similar thing, or interestingly enough, in post-Lyme, there's been a mitochondrial injury. So I would say, and many of those people who have had Lyme disease for a long time will then become chemically sensitive as well. So because just a little bit of chemical hurts what's left of their mitochondria, and so they're going to get worse, right?
Sure.
Right. So that's one of the big places where lots of people are coming to my clinics because they're tapped out. They've seen all the physicians. They've spent $40,000, $50,000 doing medical care, and now they're tapped out. They don't have anything else, but they've got a few bucks they can spend per week in hyperbaric, and they'll come just to make sure their mitochondria are getting better. So we're directly helping improve all of the genetics of the mitochondria themselves. We're improving the SOD production, we're improving the glutathione enzymes. We're also improving the electron transport chain by providing an unlimited budget for 6 to 8 hours a day after your treatment.
One of my good friends' mother has Parkinson's. Okay, that's a big one. We're seeing lots of Parkinson's.
Yes.
And now what I heard from my scientist friends that are working in the chemical arena is, Parkinson's they don't get the diagnosis till very late after there's been an awful lot of destruction of the area that's impacting that kind of movement. Have you worked with people that have Parkinson's, and do you see anything on that?
So I have quite a number of patients that have Parkinson's, and they have home chambers. So they're working with that. Again, this is a neurological illness, and so they're working at the low pressures because it's safer for them. I would say that it doesn't directly affect what's going on in their brain as its primary reason for working. I think it's working because it's helping everything else in the body work better. And then we can improve dopamine function somewhat because we have an unlimited budget to fix everything else. So there aren't other medical problems pulling on the energies of the body that would be trying to heal the brain. So you asked me about problems with hyperbaric.
Yes.
Okay, so I would say the major thing that people worry about is oxygen toxicity. And this is one of the reasons why I really like the idea of low pressure hyperbaric at 1.3 atmospheres. There's really no danger of oxygen toxicity. And since the brain itself is so sensitive to oxygen toxicity, and because so many people, particularly those who are self-motivated to want to seek out a therapy, are going to want to do something, and they're going to say, well, if some is good, more is better. That's not true for somebody with CTE or post-traumatic brain injury. They may be much better served by lower pressures at a lower rate so that there is no possibility of that vasoconstriction that could happen with oxygen toxicity. So that said, since there are a lot of situations where we do want to use higher pressures, I would say that people should limit their sessions to at the most 100 minutes. The most recent work that Dr. Jason Saunders did was using 100-minute sessions 3 times a week instead of 5 60-minute sessions a week. And during those sessions, there's a removal of the mask every 25 minutes. So if I take the mask off for 5 minutes every 25 minutes, I won't get oxygen toxicity for sure. So what would oxygen toxicity look like? It would look like a worsening of symptoms rather than an improvement in symptoms. And it would happen because I overwhelmed the mitochondrial capacity to clear up oxygen radicals that I was actually producing by improving that mitochondria's health and wellness. The mitochondria is better at doing what it should do, but now it's also making more crap, and it can't get rid of the crap as fast. Can't get rid of those reactive oxygen species. As that person continues to be in the chamber, those redox reactions are all going to be improved. Their ability to get over the reactive oxygen species is going to improve. And we just have to wait for that. But in the meantime, we're having people who are doing a 90-minute session. They take 3 air breaks. And I'm going to be doing a study this summer with We're going to use 40-year-old athletes, and we're going to look at some of the same parameters that Dr. Saunders looked at, and we'll be doing those 100-minute sessions, but they'll have 4 air breaks. Every 25 minutes, they'll take the oxygen mask off. So I would say the dangers of hyperbaric have to do with the dangers that we see in a lot of biohacking. If a medical professional is there with putting a brake on things and explaining why we don't want to, that more is not necessarily better, then I think people are safe. Yeah. I think in situations where people have a home chamber, they need to be well educated. And I'm asking the people that buy chambers, if they're going to have one in their home, to take a safety course so that they'll understand that oxygen is just right at a just right. There's definitely a just right, and too much is too much.
Well, Beth Shirley was talking to me about nitric oxide.
Yes.
And that's her area. And she said, well, if you're going to do hyperbaric, she really should do my nitric oxide supplements before you go in there, because it'll have a
this
benefit.
Is so wonderful. This is one. There are lots of things you can do. We actually supply nitric oxide support for anybody that wants it before they go into the chamber. So when you take one of Beth's capsules or 2 of her capsules, what you're doing is starting a propagation of nitric oxide synthesis in the body. So nitric oxide is also a gas that's made like this in the surface of my blood vessels. Inside my blood vessels, there's this beautiful hairy stuff called the glycocalyx. And it's where all of the biology of the inside of the blood vessel takes place. So how does the blood vessel know to dilate or to constrict? It's by the amount of nitric oxide being produced by the glycocalyx. The medical conditions in our culture where we are eating too much sugar and we're having too much stress, we're destroying, the sugar itself destroys the glycocalyx and destroys the ability of the body to make that nitric oxide that dilates the blood vessel. So taking a nitric oxide supplement before you get into the chamber will improve the dilation of the blood vessels that are bringing this oxygenated plasma to the end tissue. Also, you can use methylene blue. I've just bought some red light caps, and I'm having people come a half an hour early for their appointment if we're dealing with something going on inside the brain, and I'm having them use the cap for a half an hour and then get in the chamber. I also have an arc light bed in all 3 of the clinics, so people can either stack total body light, so they get it looks like it's a total body light machine, and you get into it naked and get all the light you can, and then you can actually get into hyperbaric afterwards, or you can stack it the other way. You can get into hyperbaric and then get into the light. What that does is it drives your mitochondrial function wonderfully, and energy can be so great that you can't sleep after that. But wow. It's pretty wonderful.
I'd like to. I have problems sleeping a lot anyway. But
and then there's another thing we can do, which is to drink hydrogen water before you get in, and that can help with some of the redox stuff that's going on.
Hyperbaric for everyone. Hyperbaric for everyone.
One for you and one for you and one for you.
Yeah. Now I kind of want to invest in your business. You know so much. Thank you for being here.
It's my privilege. Absolutely.
Let me ask you about a couple of. Beth said I might want to ask you about peptides.
I love peptides.
Tell us what peptides are.
Okay. So the most of the work on peptides was really started 80 years ago in Russia, and they were looking for how did the body signal within itself? What was the messages that the body signaled within itself? We know that there are specific molecules called hormones that when they interact with the cell membrane, they then translate into going into the nuclear membrane and actually changing the methylation of the DNA directly, and that's how steroid hormones work. There are these other molecules, signaling molecules called peptides that are made of amino acids. So they're tiny. A peptide is a protein that's very small. It's a protein that's only 47 or less amino acids long, 50 or less. And peptides signal by suggesting something on the outside of a cell. So they don't hijack the cell the way a hormone does. And peptides are in the body for a very short period of time. They're made and they then are designed to fall apart on their own, so they don't require metabolism. Whereas if I take a steroid hormone, which is a message, I've got a lot of work to do in my liver to metabolize that steroid hormone. If I'm using peptides, I don't have metabolism as an issue. I can give them to people, therefore, that have metabolism issues like liver disease or kidney disease, and they can't get things out of their body so well. Peptides can be a wonderful tool in those situations. So a peptide is a small protein that signals, it suggests to a cell that it should think about doing something. And some cells sometimes needs other votes. We need to be a little bit more healthy, or we need to give the signal more often. The most famous peptide being used right now are the GLP-1 drugs like semaglutide and tirzepatide, which are so famous, Mounjaro and Ozempic. And those drugs work by suggesting to the body that it deal differently with sugars, and that it deal differently with appetite, and that it deal differently with the way that the body moves things through. The most famous of the peptides that's currently in use is a peptide called BPC-157. If you've ever, maybe, I don't know, if you've stayed up late, since you don't sleep, maybe you've thought of this. While you weren't sleeping, you were saying to yourself, I wonder why my stomach doesn't digest itself. Isn't my stomach a piece of protein? And when I put steak in my stomach, I digest it. Why doesn't my stomach digest itself? Well, the Russians asked that question, and the answer was BPC-157. So BPC-157 is constantly being produced in our stomachs when we're healthy, and it is what protects us from having an ulcer to the acid that we're making to digest food, which is the same thing that we are because we're food, right? So BPC-157 injected multiple times per day after a surgery will improve the rate of recovery of the surgery. I myself have had several orthopedic injuries where I've injected BPC-157 into my shoulder or into my knee and had an acceleration of my healing. So that would be, and that's only 15 amino acids long. BPC-157 lasts in my body maybe a couple of hours and it's gone. And it's just suggesting to my body, number one, that it listen more closely to what growth hormone is saying, and that it be more sensitive to the movement of cells that could help heal me. Then there is the second most famous peptides are the peptides I think, or the ones I think should be famous, are the peptides that come from the thymus. And there are three that are available right now, I think, commercially. One is thymosin beta-4, which is also known as TB500. One is thymosin alpha-1, which is a drug called Zadoxin, but it's used to treat AIDS and to treat hepatitis. But you can also get it, thymosin alpha-1 on its own. And then there's a thyroxine that's also very helpful for just building immunity in general. So if I had that orthopedic injury and I was using BPC-157 and I combined with it treatment with this thymosin beta-4 or TB500, I would see a doubling of my healing, even on top of what BPC-157 was doing. There's a synergy between the two peptides that's amazing. And thymosin alpha-1 works by improving the movement of fibroblasts, which are the cells that come in to replace the tissue and build new tissue. It also improves the travel of all immune cells and improves the way that they work. Thymosin alpha-1, which is the other thymosin one that's so dramatic, which has become a drug, is a rebalancer of the immune system. So many people during COVID realized that our immune systems got out of whack and they were over-aggressive, or they were slow on the uptake when it came to cancer, but they were fast on the uptake when it came to allergy. So our immune systems were tuned incorrectly. Well, thymosin alpha-1 has been dramatic in trying to help readjust the body's attunement to itself. If I were treating someone with dementia, someone with a diagnosis of Alzheimer's, one of the things I might do is suggest that they use both thymosin alpha-1 and thymosin beta-4 together to treat their brain inflammation, to change the way that the brain was protecting itself, because it's overprotecting itself when we're destroying our own brain. So those are the big ones that I love. There are a couple of others. There are some peptides that have been discovered. These are things that we've found on the genome of the mitochondria. So maybe people don't know this, but mitochondria self-replicate, and they are independent. Their blueprint is not in the nucleus of the cell. You actually get your mitochondria as independent little organisms that come with your cell, and they have their own DNA and they replicate themselves. So we can look at the DNA of a mitochondria and see what's important. And we found something called MOT-SC, And MOT-SC is a peptide that improves the number and the function of mitochondria in the body. So if someone were taking a GLP-1 like Ozempic or Mounjaro and they were losing muscle mass, one of the answers there would be to add MOT-C to that program. And MOT-C needs to be pulsed because if you use it continuously, you can have an anaphylactic reaction to it. But you can use MOT-C along with the GLP-1 to prevent the muscle loss that is seen. That's just a few. There are over 7,000 peptides that have been published on in the world.
Wow.
A lot of that literature is in other languages. A lot of it's not in English. And so if it's not in English, it doesn't exist. But there's a tremendous amount of literature in Russian, and there's a lot in Italian, and there's a lot in some of the Asian languages.
I've been seeing on Dr. Google lately, it's been popping up for me, something called Samoralin.
Samoralin, okay.
What's that?
So there is a whole class of peptides that have to do with the release of growth hormone. The anti-aging movement in its most ugly form was basically testosterone and growth hormone.
Yay! Haven't done either one yet, but okay. I might have to.
I would probably throw myself in front of the car that you were driving first.
Really?
I wouldn't want you to do that. But
wow.
I would want to increase your growth hormone, but I would not want to give you growth hormone to do that because I would destroy the axis.
Yes.
Okay. If I give myself growth hormone for too long, I can't make it anymore.
And that's a problem.
And growth hormone is very expensive, and growth hormone as a steady signal may actually be a cancer-causing signal. Growth hormone should be secreted in the human body with a big spike at 4 o'clock in the morning, another spike at 8 in the morning, another at noon, another at 4 p.m. That's actually a little bit bigger. That's the napping spike. Then there's an 8 p.m., and then there's a 4 a.m. And what's interesting is that we're not looking at that because that only takes place in children. In adults, we think of growth hormone as something that's secreted once a day at 4 a.m. And it turns out that I can get you back to the secretion of growth hormone that you had when you were a kid by using a set of protocols. Well, Samoralin I can do it on its own with Samoralin. I only get about a 15 to 20% oomph towards where I'm trying to go. For a lot of people, that's dramatic, and it improves my holding onto water, it improves my leanness, it improves my appetite, and it can actually make the gym look like a playground. I walk into the gym under the influence of increased growth hormone going, oh, hey, I want to try that. Oh, I want to try that. No, I want to try that. So growth hormone is wonderful. I would say I don't ever want to give growth hormone, but I want to give growth hormone releasing factors. And there are two kinds. There are growth hormone releasing peptides, and there are growth hormone releasing hormones. And you pick one from one menu and pick one from the other, combine them, and you get maybe an increase of 30% in your growth hormone. And that can be dramatic. And it's something that I've actually done in my own life for about 10 years. I'm currently taking a break, and I haven't had any decline in the benefits I was having. So what I've been doing for 10 years hasn't damaged me. And what I have been doing is I've been using something called CJC 1295, which is also known as modified GRF, along with something called ipamorelin, which sounds kind of like Samoralin. Yeah. And those two together as a blend is what I've been using for 10 years. I haven't had any for about 4 months, and I have not noticed anything different. Whereas in the past, when I've stopped for a little while, I haven't felt as well. So I think part of that is the fact that I'm doing hyperbaric, and I think part of it's that I've really dialed in sleep and exercise in a way that I hadn't before. I think I'm now secreting growth hormone the way I should have been. When I wasn't sleeping, the growth hormone was substituting for my inability to make growth hormone well while I was sleeping.
Let's talk about a couple of other little hormone things.
Okay.
Quickly. So
do you want me to tell you about why I hate testosterone?
Sure. Yeah, please tell me. I'll listen to you for whatever you have to say because you're so smart. I'm like, okay. What do you do?
So I'm very concerned about men and testosterone. And I think there's this huge movement where people are getting their own labs done. And I'm so glad people are getting their own labs done. I want people to get their own labs done. I want them involved in their care. I want them educated. But then we go with hubris to the gym and we compare the length of, we compare our... We compare our
Okay, blip, blip. Okay.
we compare our testosterone level to our buddy's testosterone level, and we think more is better. Okay, but again, testosterone is one of those things where if I have a constant signal of testosterone in my body and not an up and down signal, I'm actually going to lose testosterone receptors, and I'm going to lose my sensitivity to testosterone. So that in the short term, I'm doing that kind of damage. In the long term, by giving testosterone, if I have any body fat at all, and even if I don't, I'm actually creating excess estrogen. And that estrogen is feeding back onto my pituitary, and it's changing the way my pituitary secretes the FSH and LH that support my testicle. So now I'm going to have all the testosterone I want from my muscles. But after 2 to 3 years, I'm going to have a problem with erectile function and with orgasm because I've decreased the amount of ejaculate that I'm making. The hormones that were causing me to make testosterone in the past that I've now suppressed by taking testosterone were also causing my testicle to make ejaculate, and now I can't make ejaculate. And so the numbers of marriages that I've seen decimated in the last 15 years since I've been in this, from in other places where doctors have put somebody willy-nilly on testosterone without worrying about ejaculate, has created tremendous sexual dysfunction and the ruining of people's lives. And so many people don't understand what's happened because the benefits of injecting testosterone or getting extra testosterone in a moment is so fabulous. It makes you feel so incredible. So again, what would I like to do there? I would like to use a peptide. I'd like to use human chorionic gonadotropin, which is actually probably a little too big. It's more than 50 amino acids, but it's 150, and it's a smaller molecule. HCG can be injected, and it can improve your testosterone level and return a testicle to its normal function. There's also a pharmaceutical drug called Clomid, which works in the hypothalamus to increase the production of something called GnRH, which is what causes FSH and LH to be produced that then cause testosterone and ejaculate to be made. So if a young person is in their 30s and let's say they started testosterone when they were in college football or college basketball, and they're now suffering from the inability to ejaculate or the inability to get an erection, I can work with them with Clomid and HCG to return testicular function. Well, I would rather use that if somebody comes to me in their 50s, in their 60s, even in their 70s with low testosterone and they're healthy. I would rather start with something that increases your own endogenous production of testosterone. If I can't, and you absolutely positively want to do something, I will give you testosterone cream, or I'll even give you injections, but ask you to use HCG along with it, so that we're working on it.
Yeah, I tried I had the Clomid stuff.
There's been something on the
Encycloclomid or something.
So there's been something on the market called M-clomiphene, which I think is very dangerous. I've seen really abnormal labs on it, and I've actually asked the pharmacists that know me to never prescribe it for any of my patients because they were doing it they were just intermixing it. If I wrote for Clomid, they were sometimes just giving the patients M-clomiphene. And M-clomiphene raises DHEA levels really high, and I've also seen excess LH and FSH on them. I'm a little concerned sometimes. I think labs are fantastic, but I think labs are a spark in time. I could test someone's sex hormones, and they could be all over the place. If I'm talking to a woman, and she's been told that she's in menopause. In my own life, I was told I was in menopause. I went on biological hormones and bioidentical hormones. I was on them for 2 years, and suddenly I had a baby at 40. and then they said that would never happen again. I went back on my hormones because I was still in menopause, and I had another baby. So I have a 26-year-old and a 24-year-old child who were born when I was 40 and 42 after menopause, and I never had another period. I just had 2 babies.
Oh my God! Well, I heard you had a lot of kids.
I have 9 children. So there were some things. There were days in medical school that I missed. How that happened? Well, anyway.
So we're right in your territory here. Reproductive and hormonal medicine here.
Yes.
You happen to be an expert. So where are you from originally?
I grew up in New York City.
New York City?
New York City. I was born at Mount Sinai Hospital on the east side and brought home to a penthouse on the west side. And it's history after that.
Wow.
Yeah.
So you're a true New Yorker.
I'm a real carpetbagger. Yep, that's me.
Wow.
Yeah.
And so, did you say you went to Harvard Medical School?
I went to Harvard College and to Harvard Medical School.
Oh, wow. Oh, so you're a smart New Yorker on top of all that.
I had smart parents.
Well, one of the things we can just touch on this real briefly is medical school. I mean, I've never been interested in being a doctor, although my dad was a doctor. My sister's a pediatrician. My dad's two brothers were doctors. One of them was a cancer researcher who was a double doctor. So I got a lot of exposure to medical stuff. And, I grew up liking and trusting doctors. But one thing I've been learning now is that, boy, in my career as a lawyer who ended up I've done a lot of medical malpractice cases, birth injury type cases, but also product liability type cases. So I was on the science committee and one of the executive committee of the transvaginal mesh cases. Okay. Whoa. Back in the day when we didn't know what that really was about, and then trying to find out what was going on with these people that were, having a lot of problems, and nobody knew what it was, and it was this gold standard medical product that came out, right, just being sold everywhere, and I in that case I learned heavily that that product, which was used to treat pelvic organ prolapse and urinary incontinence, was so driven by the companies that sold it and the salespeople within the companies and the marketing people within the companies. And all the information that was given to those doctors was sales information.
So I have really strong things to say about this, and actually deep personal experience. And and to some extent, as I even tell this story, I'm actually healing myself. I grew up in a household where my father was the publisher and editor of a magazine called Scientific American, and his best friend was Linus Pauling. Linus Pauling was a daily visitor in my household when I was a child. In fact, he taught me biochemistry when I was a little one. Well, I was 13.
Wow.
And I learned organic chemistry from Linus Pauling, and him saying to me, if you can't see the electron clouds of each molecule and understand how they interact, you're not doing chemistry, because you need to be able to see them dance in your head. And I also learned a great deal about mitochondrial function, and there was enough knowledge I was growing up, I was born in 59, and I was growing up sitting around this table talking about science as a 5-year-old, 6-year-old, 7-year-old in the 60s and 70s. And I learned that mitochondria were what ran the cell. I learned that mitochondria were what determined the health of the cell. I learned that as a child. I went to Harvard, and at Harvard College, I learned that in immunology. I learned that in biology. I took advanced classes and truly loved where it was going scientifically. And then I chose medical school. And I remember a lot of my professors at college saying, you don't want to go into medicine. And I looked at them like they were crazy, because I'd had a family physician that had been the other best friend, the other person that was always at our home and whose home I was always at and who I traveled with internationally, who really mentored me. And he was a wonderful man. So of course I wanted to be a doctor and wanted to go to medical school. But my professors back then said, maybe you don't want to go because something dark's going to happen. But I didn't listen to them. I thought they were ridiculous. And I went to medical school. And I went into the deepest rejection of myself and the deepest depression those first 2 years of medical school, because I could not sit in class. And I was a first row. They used to call me headlights. I had these great big glasses, and I would sit in the front row, and they'd say, oh yeah, you headlights, you tell me how to do this. And I couldn't sit in class because I wasn't learning science. I was learning something else. They had forgotten completely about the function of mitochondria. They'd forgotten completely about the way biochemistry actually worked. They were teaching us biochemistry wrong. They were teaching us pharmacology wrong. They were teaching everything wrong. And I thought it was me. I mean, for the first 30 years of this experience, of this traumatic experience, I thought there was something wrong with me. I thought I was a bad student or a bad doctor. I stayed away from class. My final solution in my second year, because at Harvard the first 2 years were all in class, so it was all didactic work. I just stopped going. And it was pass-fail, and I passed, but I wasn't learning it wasn't until I got to the wards that I loved medicine again and that I understood why I wanted to be a doctor. But again, I was applying the science that I knew, and I was getting in trouble with them because I wasn't a pharmaceutical rep. So what we're creating, and this I'm talking about going to medical school 40 years ago. There was a man that taught me in my second year of medical school, when we were getting ready to go into the clinics, and every group of medical students, every 3 medical students, there was a professor that was supposed to be mentoring us. And everyone else got the really cool people. Like there was this gay surgeon that everybody wanted to be mentored by. And I got this old 85-year-old guy, and he smelled bad. And I thought, oh, this is terrible. But I was polite, and I had lots of elderly people in my life. And so I stuck with him, even though the other 2 students that had him with me quit. And he taught me physical examination. He taught me how to look at the abdomen. He taught me how to ask questions about diet. He taught me all these things that I then used all the way through my clinical practice. But I didn't get that it wasn't what other people were doing. And he said to me, there's something wrong with our food. He said, he was a gastroenterologist, and he was at the end of his career. I've been a gastroenterologist all these years, and I'm seeing things I've never seen before. I'm seeing food allergies I've never seen before. I'm seeing inflammation in people I've never seen before. There's something that's changed about our food supply. He was saying that in 1984. So there has been something that's really changed, and I think medical schools have changed to dumb us down. You're really going to put this out in the air, aren't you?
Yeah.
Okay. All right. Well, I think medical schools are dumbing down doctors and turning them into drug reps and taking away their critical thinking abilities, taking away their ability to really ask the questions, giving them too little time to see a patient. The professor for me is that patient sitting in the chair. The person who's taught me the most medicine in my life is sitting carefully listening to, I made this intervention 2 months ago. How's that intervention going for you? And I've been doing that my whole career, and that's who's really taught me. Instead of saying to that patient, well, that couldn't be true because that's not what it says in the textbook. Or that's not what I was taught.
Wow.
So I think that at the undergraduate level, we are not teaching people to think critically, and then we're pumping them full of facts. Then we are putting them into financial debt, and then we're requiring them to go to work under conditions that are impossible, but the debt is so great you can't turn it down. And I think that's created a perfect storm where physicians are no longer the wisest people in the room. They're no longer the person in the community that I'm going to go to ask for something. They're kind of the guy who gets done with his shift and goes home and has a beer and sits in front of the TV because you just can't think anymore. You're heartbroken. You're broken.
You're right. So I found in transvaginal mesh, there is a link to my other area, which is the obstetrical misadventures, which is another one of those. Women have been giving birth for a long time, generally fairly successfully in all kinds of conditions, and they didn't always need hospitals, et cetera, to do this. And so, but now it's different. And now we're into a system that is the most unnatural system that you can possibly imagine. You're sitting in a hospital. Okay, now I'm a guy talking here, but I've been through these cases before. And what I see here is what happens, you get in the hospital. You're in not a very friendly environment anyway, even if you like the nurses and doctors. You are in a sterile environment. You are in a bed. You're not told to move around. You're basically constricted.
And you're lying on your back.
You're lying on your back.
Which is changing everything.
You're lying on your back, which is not the right position. Your baby's got to come down. It's got to do all these things. And so, you're not moving. You're on your back. This is affecting it. You're strapped up to all kinds of machines. And then they wanted to get this through some sort of a reasonable time frame. So they start giving you Pitocin. And then because that's not entirely a natural process either, you get a little bit out of sync with your rhythm so that it hurts. Yes. So then they give you epidural.
Right.
And that impacts it as well, right? Yes. So then you end up with a malfunctioning labor that people are concerned. They're not even aware of it because they've forgotten how to do vaginal exams. They're not paying attention to where the baby's head is, where the presenting part is, and getting the person to move around a little bit. They're not doing it, and the woman can't feel herself because she's so hooked. She's got all the shots, right? So you know what I'm saying. Then we think we're in delivery process and we think we're getting closer, but we're really not, because we're getting swelling and we're not in the right position. But it looks like it could be getting closer. So let's try vacuums and forceps, and sometimes both. And then that was a common repeating story over and over and over again I had.
Yep.
That's one aspect of this, right? So then they're related. So then later on, you've got damaged pelvic floor, you've got torn up, you've got episiotomies, you've got trauma in the whole region, trauma left and right.
Yeah.
Then you've got, that's why I say it is punishment for witchcraft. You women are to blame, because you were doing spells in the woods a long time ago, and so we don't understand you. So it must be the women. It's punishment for witchcraft. That's why it's always so good to have someone like you on.
So if we'd had that same woman in the delivery room in a hyperbaric chamber delivery room, all the physicians and nurses would be feeling better because they were getting extra oxygen. And the patient who was on a mask and getting oxygen actually delivered into her tissues would have less swelling. The baby would have less distress. We would see less decelerations of the baby's heart rate.
Yep.
And we could take time to get this baby delivered vaginally without tearing and destroying tissue if she was in a hyperbaric delivery room.
Well, I have a doctor friend of mine who's a fetal monitoring expert, who breaks it down in terms of what's happening during labor and delivery, right? So labor and delivery, we get into expert witnesses on this and expert witnesses on that and all this kind of stuff. And so he breaks it down like this. He said, you're really looking at a few things here. Is there anything I need to do? That you're testing, how the baby's doing with regard to contractions and fetal heart rate. You're looking to see what's going on here, but and is there, and he says essentially the baby's responding with this. How did you like that one? And I was just telling you whether you liked it or not, right? But then it's like, the questions are, is there anything I need to do for the mother? Is there anything I need to do for the baby? And what are the reasonable expectations for a safe vaginal delivery based on what's going on here? Which means you pay attention to everything that's happening and what's happening with the patient. And when you're doing that, you often can keep yourself out of a manufactured crisis. Because the crises get manufactured a lot, because it would have been okay, but you've jimmied with so many factors here that now you have created a crisis at the end, right? Now you're rushing to the back to do an emergency C-section, and oftentimes it's already too late. It's already too late. Okay, so, wow, that was a big topic. Whew. And I started getting on my pedestal here. So back to the doctors, and well, let's go a little broader here. Like, what can we do now with the enlightening of the medical system?
I think what's happening is it's not happening from the doctors; it's happening from the patients. Particularly in a town like this. I mean, I don't think that there are many towns in the country that would support the number of hyperbaric chambers that I have in the city that are being used. People in Austin are aware of their health, and they're saying to themselves, I need to take responsibility for my own health. I think more and more Americans are aware that their doctors are sicker than they are, that their doctors are more anxious and getting less sleep than they are, that the doctor actually needs a lot of help with their own lifestyle. I think people are saying the answers might not be where I always thought they were going to be for me, in pharmaceutical drugs and in the intervention of a physician. Maybe the physician doesn't actually have my best interest at heart and is just following the profit motive. What can I do? And so patients are educating themselves. They're getting their own labs done. They're working with paramedical kinds of organizations that are through chiropractors or acupuncturists, and they're also biohacking. They're reading about these topics online. They're listening to podcasts. They're looking at YouTube videos on health. So people are educating themselves, and I don't think that's going to be the answer for everyone, but it is certainly an answer for some people, and particularly in this town. Long term, there's going to have to be a revolution, and I don't know how it's going to happen, but there has to be a throwing over of the current levels of authority. State board and federal looking at how we practice medicine has to change, and we have to really think about whether things are, well, we have to look at our literature. I mean, our literature is a joke everywhere else in the world. We know that in the United States, it's paid for, and it's got ads on it. I mean, they didn't want to show them at first, but now sometimes there's ads on the very front of a medical journal. And so is this concept of evidence-based medicine really doing us a favor, or is it harming us?
Well, it's very interesting to watch, and we try to stay out of politics in this program.
Did I go close to politics?
You didn't, but
okay.
But I'm going to.
Okay.
But it's more policy politics. Okay, this is not Republican Democrat type things, because I'm not a big fan of either party. I think we got to get back to some human values here, but it's been interesting to watch in the medical arena what's happening right now with the Bobby Kennedy in there.
Yes.
Who, and I've known him from the environmental law community for a long, long time, and he has done good work in the legal community and tried to clean up environmental stuff and all that. So to see, and I understand people could have trepidations about him for whatever reasons, his personal life in the past, or he's not a doctor, what have you, but his what he's talking about, he has raised these issues about the literature that is conflicted and stilted and paid for, the rotating, revolving doors between industry and pharmaceutical companies,
yes,
the lack of training in nutrition and health, and the fact that we have a very, very sick, chronically sick population that's increasing, and nobody can disagree with this. I mean, I talked to some the who is the lady that was is doing this, but she was basically talking about how we are going to extinguish ourselves because our sperm counts are going so low.
Yes.
I can't remember her name right now. I'm kicking myself, but the fertility level is going so far down.
And it's not just sperm counts; it's women are no longer ovulating either.
Both.
So
yes.
the whole dance of FSH and LH has really changed for women because there's so much exogenous estrogen. They were just swimming in estrogen or estrogen-like substances.
We're loaded with it. I started looking at this years ago. I got a unique access point because I'm lucky to have a friend that's the head of the Ramsini Institute, right? Or people that were involved in coining the term endocrine disruptors. I got interested in obesogenic chemicals and materials a long time ago, and I remember. Do you know who Pete Myers is?
I don't.
Okay, so Pete Myers is the guy that is well known because he kind of publicized the BPA and those kinds of things. Okay, and he told me he was telling me a few years ago. He said that's just one of so many chemicals that are so harmful from being estrogen mimics, and they're everywhere. They're everywhere, and the effect of them is so profound, and the mechanism is so similar in all these different kinds of things. But he said, for example, we always were taught the dose is the poison. The dose is the there's a difference between what's beneficial and what'll kill you, and it's always a matter of numbers and what have you. And if you've ever looked at how they determine what's a safe level of a chemical, it is ridiculous because they don't. It's negotiated based on not very much evidence, and it's between industry and government and everybody else. And it's just negotiated numbers, and they're always wrong. and they never know what the true exposure level is because there's other factors always. So it's not just, you're never just exposed to one chemical or one product. You're getting hammered with it, and we're getting hammered with it all the time.
And we're getting hammered with things that may be synergistic in their
Exactly.
Yeah.
But the thing that Pete Myers told me that stuck with me to this day, he said, was, we're used to seeing these levels. Well, you can be exposed to a safe level is 0.5 something milliliters or whatever it is per day. I'm just making up numbers, but he said that's you're used to seeing those kinds of numbers, and then going, well, assuming that this is going to be either down or up, off, but maybe 20% off, or just to get ballparking it. He said, so they'll adjust it later. They'll figure out, well, maybe our safe zone is not where we really think it is. He said, but for these hormone things, he said, for example, these the BPA type of things, the dosage which has physiological effects is like 1/2500th of the allowed limit. Now think about that. He said those are amounts that we couldn't legitimately measure 50 years ago. Okay, so it's huge. It's a big factor, and we're bombarded with those from everywhere, and we're putting them on our body. We're rubbing them under our arms. We're putting them on. They're in the creams that we use. They're in the packaging of our food.
They're in our clothes. They're in the additives to our clothing.
Yes.
Yeah.
So
yeah.
What do we do? Run around naked in eat in the Garden of Eden now? How do we get back to some semblance of health?
If we're proposing an environmental burden that I cannot affect as a single individual, I can eliminate some of the things that would make it worse. So if I were having this body burden exposure and I were also eating processed food, I would triple or quadruple the effect of that exposure on my body. If, on the other hand, I'm eating organic, I'm not eating seed oils, I'm not eating gluten, I'm not doing anything that actually causes damage to my body, then I have the opportunity to perhaps be a little bit stronger through that whole process. If I'm doing things like hyperbaric, where I'm regenerating tissue, I'm helping my body replace itself faster. If I'm getting exercise, if I'm maintaining my nitric oxide levels so that I have blood supply to the areas and the tissues of my body, along with delivering nutrients, I'm also removing toxins if I'm delivering blood. Those would all be things that would help, but if I'm taking cyanide in every day, I'm finished, no matter what I do. But I think that there are many people in our culture that are doing better because they are living that way. And they'll tell you they feel better. It takes them about 2-3 years, but they feel better. So they're eating clean, they're exercising, they're sleeping well, they're not putting extra traumatic stress on themselves by, they're understanding their inner workings of their being, they're finding peace even in chaos because they can. Then they're going to be healthier. So you can do what you can do for yourself, and then you can work as you can with people like you to try to change the way laws are made. But that's as much as we can do.
Well, I'm remembering. So I went to college back I'm older than you. So I went to Colorado College for a year, and then I was at the University of Wisconsin-Madison, which was in those days a very progressive university, and we were out to change the world. We were against the Vietnam War. We were for legalization of everything. We were for we thought we changed the world. Well, we didn't. I remember in those days being exposed to people that were back to nature hippies, and they were people that I knew they would go off and they would start an organic farm someplace and just basically living out in the woods, and warning us at that time about the dangers of all these synthetic products. And boy, those hippies seem smarter all the time now. When I look back at this and I go, good Lord, boy, they were making their own soaps, and they were creating their own stuff. They weren't using, there wasn't as much plastic at the time.
Right.
They were basically using it was old school.
But there are truly great people out there. I was on a Zoom call with a farmer in Indiana, and he has over 1,000 head of cattle that are being raised on grass, and he's looking generationally at his cattle. So he doesn't believe that if I could take a calf from a corn-fed cow and I grow that on grass, it's going to have some of the same epigenetic problems that its mother has that was grown on corn, because that's what it got. I'm going to have to get 3 or 4 generations away from that corn-fed animal to have the kinds of things I want to see.
Wow.
He's using science to look at the genetics of his animals, but he's also looking at their blood and their muscle tissue, looking for arsenic, looking to make sure that they have the right like electrolytes in them. And then he's also looking at the soil. He's looking at boron and magnesium and molybdenum in the soil, and then seeing if that gets into the grass. He has to send the grass to Norway. Apparently that's where the lab is that really looks at the nutrients in your grass. He looks at the grass, and then he looks to see if that gets transferred into the animal's flesh. So there are scientists right now who are using, there are scientists who are farmers who are using organic farming in the way they should. I then met with another organic farmer just 2 days later, and I told him what this guy was doing, and he went, wow, I'm just looking at my cows, and I never thought about who their mother was, and never thought about the soil or the grass. I'm going to have to raise my game. So I think also it's about people. I think sometimes you and I might experience this. There's the fatigue of the battle. I've said it so many times, oh, fuck it, I'm just done. I'm going to go home and I'm going to mind my own business and I'm going to get my business done. And that's what this young man is doing, who's testing all the way through. He's not out there telling other people what he's doing because he's sick of being shot down. So he's just doing it. So another person who wants to also be an organic farmer isn't being influenced. And that guy's got 2,000 head of cattle. Right.
Well, this ties into yesterday's conversation with Elliot. We're siloed.
Yes.
And there are a lot of people doing good things out there, and we can benefit from paying attention to each other. How do we find each other, and how do we share this information? Because
can I start with one really important thing? I really want to say this. I think we have to put down our victim, our pessimism. I think we have such deep pessimism that sometimes we can't even get out of bed and we don't have the energy to go. And yes, I have that appointment to go talk to somebody, but I don't go because I'm tired or they're not going to listen to me.
That's me.
And if we can, when you reached out to me, I wanted to do it right away because I knew if I put it off, I'd never do it.
Yeah.
and I think it's so important to understand that the life can be better if I will go into it knowing that it is better. Knowing that there are wonderful people, knowing that if I come with a loving attitude and I don't come ready for fight, that there's going to be all kinds of places where we agree, even though we may disagree on a few. And we may disagree on ones that are as big as my thumb, but they're not really important to the overall issue. And so there's so much more that people can do with a loving heart than they do with a pessimistic, defensive, angry, anticipating rejection heart. And so I think first we need to examine our own hearts and say, couldn't the world be better if I expected it to be better? If I'm so used to it's all going to shit in a handbasket, which is it's being pumped into so many young people now, then I won't do anything. I won't communicate with anybody. I won't tell anybody my hopes or dreams because I'm so sure they're going to be shot down. But I think we have to have the courage to love ourselves enough to love others.
That's a radical thought that we have is love yourself and be good to yourself and be good to other people. It comes back to that over and over and over again. And so you tied perfectly into some things that we were into, which is, what if we do dare to envision a better place, and what if we realize that we're really already there? If we could just open up a little bit more,
and if we all talk to each other,
Yeah. Yes.
And what my beliefs are in those silos that keep us separated are really not the things that make the difference. I think we can all agree that we want clean water. I mean, we can all agree that we want soil that's got nutrients in it. If I'm a being, electrical being, and I don't have the right amount of sodium, potassium, and magnesium and molybdenum and boron. And if I don't have all of those, I'm not going to carry charge. I'm not going to have the energy to get here in the morning to talk to you. I'm not going to have the energy not to be irritated at you. So we have a population of people who are sick and tired, and so we're divided from one another.
Well, see, we got into some really interesting territory, didn't we?
We did.
And you know, this is something where it just kills me every time that I see politics playing out in the stage, and because everybody's promising an awful lot of stuff, and there's an awful lot of hating on everybody else and blaming everybody else. But when you get down to it, don't we all want the clean environment? And don't we all want people to have enough food and to be at peace? And
could it be that we are being manipulated into these silos that keep us from asking for those things?
Do you think so?
Might be.
It could be.
Kind of. See, wanting is an evidence of having is an evidence of wanting.
Well, yeah.
So, I mean, if we're here in this place where we don't have clean water and we don't have clean soil, and we're focused on other issues that have nothing to do with that, maybe that's serving those who don't want us to have clean water and clean soil.
That was one of the hardest things for me to get, was that that there are agendas out there that are misleading agendas that profit by keeping us separate and keeping us in fear.
Yes.
And I was really slow to get to the table on this one, and a bit naive. And you know, you hear about the incentive not to really heal people, which is, I'm like, that's just crazy. That just sounds nuts. Like, how could there be? Why should there be an incentive to this? But you know, so much of the world is financially based, and it's hooking people, and so it's the addiction cycles are brutal. We didn't even get into this, but you know, that addictions to all kinds of chemicals, and the addictions to, now we have devices, but and then there's addictions to street drugs. There's the addictions to pharmaceutical drugs. It's this, like, everything is like here we are, and it's like that cycle is primarily driven by money.
And I have this horrible story I tell myself in my mind, which was in the 1940s and 1950s, before I was born. There were cadres of wealthy and powerful people who sat down and said, what is the one thing there won't be too little of in 2020, and 2030? And the answer was people. Well, what can we do with excess people? We can harvest suffering. And what we have in the medical field, and what I think I have witnessed as a physician in the 40 years of practice, is that we've been harvesting suffering. And we have a system that creates the suffering. We have a diet, and we have unclean water, we have unclean food, we have processed food, we have ultra-processed food. These things are toxins to the human body, and they create the need for pharmaceuticals. And they create them in a systematic way. I mean, there's many books out there showing you how there's an introductory drug, like an acid blocker, that interferes with your ability to absorb boron and molybdenum and chromium and magnesium and calcium, and then the body can no longer run. I can't even get acid into my stomach. I don't have high acid anymore. I actually have low acid now. And now I can't digest, and now I'm going to develop a damaged glycocalyx. I'm not going to be able to contract and open my blood vessels. I'm going to have hypertension, and then I'm going to go on to develop metabolic syndrome and diabetes. And then with that, so that one drug that I took 5 years ago has now led to me being on 5 pharmaceuticals at age 45, and then 16 pharmaceuticals by the time I'm 84, if I make it that far.
Yeah.
And that's really the way the system is rigged. And as the physician going in there, if the physician is kept distracted and overwhelmed and constantly overworked and constantly dealing with 1,000 different things, the doctor doesn't have the ability to take a step back and say, wait, what's going on here? Mrs. Jones isn't getting better. And the numbers of physicians wake up. They do wake. Every once in a while, a physician will go, well, wait, I've been doing the same thing. And the patient gets better for a month, but then they're worse. And then they've gone on to develop a new disease. And those are the doctors that break out and go into alternative medicine. But there aren't many of them because the rest of the physicians are so overwhelmed they can't come to that conclusion. They can't see that what they're doing actually doesn't work. And we also have a system, I mean, in my own bizarre little practice that I opened in 2011, I have people that have been with me that entire time. I have patients that have been in my practice. The majority of patients in my practice are 10 years in, 12 years in, 14 years in. I'm doing these dictations where I say, well, because I've just started using an EHR. I'm very slow. I've been in paper forever. And so I'm dictating and I'm saying, and this patient's been with me for 10 years. There's so many physicians don't have that privilege. To be with someone, to be for someone's doctor for 10, 15, 20, 30 years gives me a whole different perspective on caring for a patient than if I only see them every 2 years and their insurance changes and my office drives them away and all of the problems with the business of medicine makes a patient not stay with the doctor long enough for that doctor to learn anything. The doctor just knows what the textbook said they were supposed to do or what the drug rep said they were supposed to do. They're not looking at the patient anymore as their teacher. And the privilege that I've had to work with patients who have given me my education is the greatest privilege that I've had in medicine. It's not, I mean, I went to a fabulous medical school. I got some of the best training from mentors in my second 2 years, but in my last 2 years. But the education I've really gotten is from the patients that have taught me what works and doesn't work, and who have also taught me that in the end, it's really about what's going on in my heart, what's going on inside, what are the emotions that I'm generating, what are the feelings that I'm basting myself in all day, because that's what's going to produce or not produce disease. And my practice is now sort of psychotherapy by labs.
How do people find you? How do we locate you?
Okay. Well, my clinic is Westlake Medical Arts, and it's in Westlake. My email address is E as in elephant, P as in Peter, W at westlakemedicalarts.com. And I look at those emails every day, so you could reach directly out to me if you wanted to. And you can also call my clinic, which is in Austin at 512-327-8700. Or you can look up ATX Hyperbaric. So the hyperbaric clinics are known as ATX Hyperbarics, and there's one in Lakeway at 101 Medical Parkway. There's one right near my clinic in Westlake at the Westlake Hospital. And then there's a clinic in Round Rock right next to the high school. And that you would go online and you'd look for atxhyperbarics.com. So
we hope you will stay involved with us.
I would really love to.
I would love to have you. You know, we're developing some advisory boards and some networking things, and I'd love to have you participate in whatever way you feel comfortable. I know you're very busy.
I would love this.
But we want to elevate the game.
Yes.
That we need a revolution in medicine and many other things.
Many other things.
It's not just medicine. We pick on that. Most of our systems are really broken.
Yes.
And they just can't be patched back together again. So it's time for some really radical restructuring of things. But I know you got to go. So thank you so much for your time.
Thank you for this.
And I'd
This
love
has
to
been
have you on
wonderful.
again, and let's stay in contact.
I would love it.
And I would love to come and see you at your clinic.
Please come. I'd love to see you. Thank
Great.
you.
Thank you.
Bye-bye.